PhD in cognitive neuroscience and master in clinical audiology, and also certified by American Institute of Balance. And also my current achievement, which is I awarded a Women Scientist Award from Korea since 2005. So basically what we are trying to talk in this sharing is actually update on latest innovations in balance rehabilitation. And before we go further, actually, I just want to discuss where I think management of the balance disorder cases is very challenging and controversial. And if we can see here, I think this is a very global world issue, same as like COVID now, which is lots of conflicts and unresolved issues raised by the clinician and researcher in terms of diagnosis and treatment. And I think we do have lots of great gadgets or great equipment in terms of diagnosis, but the treatment is still in a hard thing, I think, even in Malaysia. So selections of the appropriate treatment of the central and peripheral vestibular disorder are really, really important, actually, in order to us to help and assist all our patients to reach the desired recovery. And physical exercise actually has been shown to help patients with balance disorder, especially with peripheral vestibular disorder. And if you can see in this slide, actually this is by the Paula, May-June 2014. It shows that majority percentage of the vertigo patient is actually 35.1%, and then followed by imbalance, which is a very common issue among aging people, elderly, where it's 24.3%, and also there are also pre-syncope, which is if you like headache, something like that, in 60.2%. And if you can see here, the rest is like floating sensation mixed with pre-syncope, vertigo, and other types. So all these things is actually, if we can know that BPPV is one of the most commonest pathology in vestibular disorder, and as we can discuss further, and I think it's well covered, I think in the vestibular management. And this is another, if you can see here, BPPV is still among the tops of the diagnosis worldwide. And of course, I don't want to go too long, because in this short time, I just want to share what we do or what we have in our practice. And what is a vestibular rehabilitation is actually, if you agree, next to love, balance is the most important thing. And because it's really, really give us a great impact in terms of our daily life. We mean like in terms of our activities, work, and everything. So this is why I think management is much, much very important. So if you can see here, balance control in human is really what we call complicated, and it needs integrations of the vestibular, visual, proprioceptions, and also we need to have good input integration by cerebellum cortex and also the brainstem. And of course, we do have like a motor output, which is VOR, motor impulse, and also for the motor impulse for our body and posture, which is vestibular spinal reflex. So all these things is actually the basic concept that we really need important in order for us to understand the rehab or vestibular rehabilitation concept. So here is actually, I want to emphasize why we are talking about natural phenomena. This is what we call vestibular composition. This is why we are saying, I'm always told my students where I think the natural compositions or promoting the natural vestibular composition is very, very important, especially in vestibular disorder patient. Of course, I do understand in the beginning or like 1 week or first week, very, very acute attack. Of course, we need some medications, but in terms of long term, we do need something which is can give us natural phenomenon and also a natural compositions in order for compared to we are depending too much to medication, for example. All right, so if you can understand here that there is a 4 concept, the most important thing in central compositions issues that implies plasticity, formations of the internal model, learnings of limit, and sensory vetting. So if you can see here, in terms of cerebral composition, there are several central connections involved. For example, like vestibular ocular reflex, vestibular spinal reflex, vestibular colic reflex, autonomic connection, and all those things. And this is why there are lots of multiple options of the treatment now. If you can see like optokinetics, stimulation, everything. So this is thing that we can discuss further in our next slide. So before we go further, there is a lot of impairment due to the dizziness, and there are possibles of abnormality, for example, like gaze instability. So this is very common where people start to have like what we call oscillopsia, people who have vertigo, abnormal perceptions of motions, and also altered perceptions of orientation in space, poor postural alignment, for example, like this is leads to fall, a fall, and then inappropriate use of the balance strategies also can lead to the fall in certain dizziness or imbalanced patient. And if you can see here, we are not, when we are talking about dizziness, is a very broad and general, and it can manifest from a vestibular disorder, but also can occur from various or other things that we should think. For example, cardiovascular, neurological, metabolics, visual, and also visual and also psychological disorders. So this is very, very important for us to have a very broad concept apart from vestibular disorder. And then and of course, sometimes in our patients, the suffering that you see is not same as a suffering that is never talked about. For example, that's why, for example, in my clinic, normally I will give some space to my patient, at least 5 to 10 minutes, to explain actually what their feelings, what's their actual feeling, what their actual impacts in this in their real situation. So this is why I think you need to give some time to your patients, all right, before you go further. So in terms of vestibular hypofunction, there will be both. It can be unilateral or bilateral. And if compare bilateral and unilateral, of course, bilateral is much more complicated or very hard to be treated. So for example, like bilateral vestibulopathy, and normally in case of like vestibular neuritis, labyrinthitis, mini disease, and post-surgical or post-concussion syndrome, these can be affects majority are one sites. All right. So when the vestibular dysfunctions or malfunctions, there are lots of unresolved conflicts, sensory conflicts, and you can see here patient will have dizziness, vertigo, and also disequilibrium. And here here, that's why I'm saying vestibular rehabilitation therapy is a very, very important, and we really need to have a good collaboration between the our physiotherapy to help people to gain or to have their natural cerebral conversation. So this can lead to vertigo, dizziness problems, other symptoms. All right, so if you can go here in terms of management, because as we know that BPPV, and I normally always teach or always taught my student where we have to, when you have a vestibular disorder patient, you need, of course, to know whether this is BPPV or non-BPPV. And if non-BPPV, you should discriminate whether this is peripheral or central. So this is much easy for you to narrow and for you to guide or to have a proper diagnosis at the end, also a proper and optimal management. For example, like BPPV here, of course, we do have a lots of canal repositioning maneuver, and of course, you heard about GAN CRM, and compared to APLI, when they say the recurrent rate for GAN CRM is much, much lower compared to the APLI, which is, I think is good and also well established or used in other countries before. And also labyrinthine concussion, also we are always promoting to use vestibular rehab. Mini disease, we are promoting high dose beta-histine, low salt diets, and also surgery and transtympanic gentamicin injection. Labyrinthitis also for vestibular rehab in the long term, but in the acute, of course, you can still give them symptomatic relief, for example, like antimazzolone, cinnarizine. All right, then peripatetic fistula, vestibular neuritis. So if you can see here, majority of the vestibular disorder is actually the main or the best or optimal management is actually balance exercise. And then there are only a few vestibular disorder types that need pharmacological intervention, and for example like anticholinergic, antihistamine, benzodiazepine, but I'm rarely practicing in my clinics. I was in vertigo clinic in UC Science Malaysia since I think 2007 until now, alhamdulillah. And also a calcium channel antagonist, also GABA modulators, or this is thing some people used to use nootropic or piracetam, which is vitamin B12 vitamin B12. Sometimes some people love to do that, and then it's depend because they say in this can improve our cognitive functions and so on. So the most important thing here I want to emphasize is actually treatment to manage vertigo symptom. For example, like vestibular suppression, like meclizine, dihydroxyzepam, antiemetic, you can use, but not more than 2 weeks, because there's a lots of research shows that it's going to delay the natural cerebral conversation if the people persistent use this for more than 2 weeks or 1 month. So that's why proper medication offered to patient is very, very important. And you should, I think, we should explain. You should explain. All right. So and if you can see here, there will be vestibular patient, which is BPPV and also non-BPPV. This is always I try to discriminate, and you can see here in terms of BPPV, you can use a lot of, it depends, anterior canal, posterior canal, or anterior canal, posterior canal, or lateral canal, horizontal canal. So for example, like posterior canal, you do have lots of options, like Epley maneuver, you have gun canal repositioning maneuver that I love to use, and some people use Seaman maneuver. And anterior canal, which is you can use fast Seaman, and for the lateral canal, you can use low test or what you call deep hanging test. So this is a deep hanging maneuver. So all these things is option for BPPV. But for non-BPPV, for example, like post-vestibular neuritis, post-vestibular labyrinthitis, and recurrent vestibulopathy, balance exercise should be started as soon as possible after the acute attack in every patient. All right. So if you can see here, this is something like the customized treatment option that we offer in BPPV and non-BPPV. So for example, like BPPV, as I mentioned before, and even in my clinic, actually, I'm rarely use Brandarov. I'm quite familiar with gun CRM and also with Siemens also. And also before this, we are also using Epley, but after we heard that gun CRM, the recurrent rate, which is much more longer, which is my patient came back to me after 4 or 5 years. So this is much better compared than Epley. I think some people will come back to you after 2 years, something like that. And then also unilateral vestibular, there is a concept of adaptation, substitution, or habituation, and then also motion sensitivity, also one of the concept of common symptom among vestibular disorder, or what we call visual vertigo. You know, in current status in vestibular disorder, they will face some stage. This is what we call visual vertigo. And the concept that we are using is actually optokinetic stimulation. This is when you ask your patients to focus on the lights moving. So at the end, they're going to be habituate. And then the fourth one, this is what we call bilateral vestibular loss. And this is in substitution and also adaptation. And also central vestibular, also the concept of habituation use in terms of the explanation of their cerebral conversation. And in terms of vestibular rehab, I think the focus on priority patient, you have to be customized, not too rigid. You know, for example, here when you need to ask your patients what's their main problem or main difficulty. For example, in certain case, they don't like a moving object, something like fast moving object, for example, like car on the road, something like that. So at the same time, you should think of the optokinetic stimulations where they need to focus to that objects or the lamp or light, and at the end they're going to habituate. And this is what we call client focus. You need to ask before and after and there is a lot of, I think, a questionnaire, there is a lot of assessment that normally used. For example, like we use foam, and we use here Malay version vertigo symptom scale or vertigo symptom scale. And also the management is actually based on restorations adequate motor behavior by adjusting the input and output relationship of the VOR and VSR and restoration optimal functional independence. Okay, so before, if you are talking about vestibular rehabilitation exercise, there are a lot. And I think there's a lot of research shows that when you start to do exercise, you should promote your patients to start with the head and neck surgery, because there are few research shows that when you are starting the movement with the head and neck movement is going to enhance or faster the cerebral conversations compared than you start with the postural stability or postural positional movement, something like that. So there are a lot, I think, even in YouTube, or they show that what kinds of the basic concept you can realize we use cotton kutsi exercise, and then there is a customized cotton kutsi exercise. And I will show you the next slide, whereas our module, we use balance exercise, or what we call balak. It's a combinations of the customized cotton kutsi exercise plus prayer movement. All right. So if you can see here, treatment for vestibular hypofunction is actually gaze stabilization exercise to coordinate eye and also head motion, and also habituation exercise is actually to enhance or to stimulate patients to become more tolerant of the movement, and also standing balance activity, walking, fitness, and endurance with the tolerated. So all these things is actually able to prevent from fall, especially for those who are in aging people or elderly, and also when we are talking about rehabilitation exercises, actually able to encourage our vestibular adaptation and compensation, and the effectiveness in recovery from vertigo required natural reorganizations and adaptation. So how we want to promote the adaptation and compensation here is actually, this is the main issue. I mean, this is the most important part in terms of to have good recovery in our patient. Of course, in every patient, they really needs for fastest recovery. Even they have suffered for 10 years vertigo, but they really hope they will improve after 1 week or 2 weeks. So this is really hard. So that's why you need to explain to your patient, if they do the balance exercise very well, it should be fine. But if you are not doing the balance exercise frequently and in a great or perfect movement, is not going to be happen. So that's why there are several research. They investigate the sensory conflicts to promote the neural learning, and also rehabilitation exercise are particularly actually very, very important in majority of vestibular disorder. All right. And then when you're talking about cerebral conversation, some people or some patient will ask you how long. It's depend on patients. If they are very disciplined, or they are very follow the protocol movement, and because I think it's very hard to find home base, isn't it? But in our University Science Malaysia, we do have our home base. This is what we call balaks. Balaks, it was created since 2009, and it has been translated into 60 languages. So people can do at home, because not everybody are able to came to hospital for 2 times or 3 times per week. This is very hard. Some of them, they are very defaulted because there is no caregiver to accompany or to send them, because in vertigo patient, normally they unable to drive on their own. They have some difficulty to walk, and especially for aging people. So if you can see here, chronic vertigo and steadiness associated with PVD, peripheral vestibular disorder, will improve over 6 to 12 weeks. Results of cerebral compensation. So cerebral compensation happen is actually habituations or adjustment of the CNS to change in signal from peripheral vestibular disorder, and also there are also sensory substitution. CNS release on their balance organ. For example, like they are shifting to other vision, normal functions of the vision, also normal functions of the proprioception. So this is most the concepts that we are understood from the natural process of the cerebral compensation. And in some patients, if you can look, they are complaint of neck pain and neck stiffness, and this is one of the common side effects since movement causes a dizziness. Therefore, patients tend to avoid head movement. For patients heat, soft tissue mobilizations, joints mobilization, stretching, postural re-education. So this is a few options that you can offer in neck pain or stiffness patient. Apart from some people will ask, what type of balance exercise? Yes, you can do anything. There's a lots of options. For example, like standing balance exercise, walking, yoga, tai chi, and now I think I heard in India normally they use a trampoline. Trampoline. But the most important thing, the concept in balance exercise, actually you should do the exercise during eye open and eye close. Eye open, eye close, and then you have to increase the speed from slow to faster and more faster. So this is the most important concept. For example, your patients having some problem with head and neck problem. They start spinning imbalance where they're turning their head. So the starting exercise is actually they just need to do exercise to turn their head right, left, slowly with eye open, for example, like 20 times, and they repeat with the 20 times close, and then they are getting faster and faster. So indication for therapy is actually a lot for example, like in unilateral vestibular neuritis, labyrinthitis, something like that, and also fluctuating, and there is some issue actually in fluctuating vestibular problem, for example, like Meniere disease, and in perilymphatic fistula, there are a few research shows that balance exercise can improve or can give benefits to this group of patients in chronic cases. And also post-traumatic vertigo also, and also multifactorial disquebrium of the elderly. And also if you heard about mal-debarkment syndrome, also balance exercise is one of the good option for an optimal management. And psychogenic vertigo also shows some benefit if you are combining with the balance exercise. So what I'm talking now is actually examples of disease or pathology that can benefit from balance exercise, and also like acoustic neuroma cases, stroke, post-stroke patient, and as you agree, 80% post-stroke people, or even they are cured, they will have a balance problem. And post-head injury or concussion, history of inner ear problem in diabetic patient. All right. If you can see here, in terms of mal-debarkment syndrome, there are quite common their feelings on board. So I'm quite frequent use or offered balance exercise in among this group. And some people are talking about combination therapy. Yes, you can do, especially in those who are in very acute attack. You can start or combine with beta-histine with the exercise, and then you slowly drop down. So if you can see here, there are types, or chronicity of every disease is what we call a difference. So it can be temporary, changeable, permanence, or some of them are unknown. So, but if you can see from this chart, I don't know whether you can see very clearly here, and whatever is actually the extent of potential improvement is actually depends on rehabilitation. So rehabilitation. So how much you do rehab, how frequent and how correct you do rehabilitation is the most important outcome for your balance exercise in every patient. So as I mentioned before, there are lots of type of balance exercise. For example, like Carlton's Coetzee exercise, customized Carlton Coetzee exercise from London, I think by Mauricio Paula and Professor Adolfo Bronstein. And then also Balax. Balax is actually one of the combinations, home-based video module for balance exercise, combination of customized CCE plus prayer movement, Muslim prayer movement. And also there's a lot of options like VV game, but it's a bit costly, and optokinetic simulation, for example, like disco room and something like that. And as I said, Nintendo VV game and trampoline also can be very helpful in terms of balance exercise. And I think into acoustic, for example, I'm not from this company or whatever, but I heard they have a very good, balance rehab, something like that. And then this is also, they have optokinetic stimulation. So this is good. Anything which is the more challenge, you should remember in balance exercise, the more challenge you give to patient, the more faster the recovery. For example, if you are asked patient to sitting on the ball, close their eye, move their head, and what if they lose their proprioception? So this is much be a good and much be better outcome in patients. So this is my team actually for balance exercise, which is this is my Professor Din, one of the prof, and also he is one of the one that involved in this Balax team of balance exercise. Product. So actually, I really thankful to all my lecturer and teacher in National Hospital, Neurology and Neurosurgery, when I was there in Central London on 2006. And then this is all our Balax. This is why I'm putting my topic here is actually update on latest innovation on balance exercise, because we do have 15 focus product for balance and also stroke patient. For example, like you can see here, you can see the slide. I think we do have almost 17 product, and if you can see here, we started with the home-based balai. This is mainly for balance disorder patient, and we do have balai stroke, which is for stroke patient. And we do have rotary chair, but our rotary chair is not diagnostic, but it's only for rehab, because we are putting inside the optokinetic room and we spin. So that's why what I'm saying, the more challenge you give to patient, the more faster recovery. And the fourth product we do have is actually Balite Stand Up. This is very simple and safe because they have a gut, and we use a car tube. We use car tube with a certain amounts of air. When people or when patients sitting on the car tube, the pressure inside the car tube are changeable. So that's why people feel very unstable, but they have a specific protocol. And this is a quite a good, I think, one of the fastest recovery where people can do guided, because they have a screen that they will follow. They will do the exercise consecutively. And then we do have also, this is cost effective wheelchair. We have stroke shoes for stroke patient, and this is our Balite mobile ritual room. This is what we call, we developed since 2014. This is like a room, dark room covered by curtain, dark curtain, and we do have a disco room, and people have to sit there 1 hour per session. We have a protocol also, what they need to do inside the room, and they have to focus to the lens object. And normally we prescribe them a bag plastic for vomiting, because basically in the beginning we have vomiting and so on. And also we do have Balite Physio. This is a guided for physiotherapists and only for stroke patient. And we do have our own Balite optokinetic drum. I think lots of you also have that. And apart from that, our 10th product is actually what we call automatic balance evaluation rehabilitation. So this is also the concept. They use car tube, but this is for rehab. And also we are now still in developing process for the assessment. It's not really like osteography kind of, but this is more to the rehabilitation. And also we do have our foam. This is what we call Balite foam that we use for assessment for before and after therapy, and also we use also for rehab. And this is our latest, this is what we call Balite Quick Balance. That it was, I think I undergone the research is almost 9 years or 10 years for this. And when I create a module, why I say quick balance is because people can improve within 1 week, because they have a very intensive, they do the combinations of the Balites, customized cotton kusi, they do combinations of the optokinetic, they do exercise on trampoline, they do exercise on foam. So this is a very challenging, but people can get much or better outcome, because I do have a lots of international patients came down to Malaysia, for example, like from Indonesia and so on. And so that's why I always offer my patient Balite Quick Balance, because they should stay with us for 3 days and they underwent very intensive rehab, like for example, like 2 sessions per day or 1 session for chronic people. All right. Then we do have Balite SVVT. This is for subjective visual vertical and subjective visual horizontal. And now, actually, we are now in stage of developing Balite Quick Balance skeleton tracking. This is much more fun when you can do exercise at home in the screen, and there is a icon that follow, and they can instruct you whether your movement is correct or not. And also we do have a dance, because sometimes people, they feel bored when they do exercise. So dance is one of the options. Also we do have in English version only, and also Malay version. And we do have also silent stroke. This is what we call Balite silent stroke child. And also the last one, we do have a Balite Solat. This is for therapy for balance, but we use totally 100% prayer movement. So you can see here, so this is what we call the room, the optokinetic room that we normally practice in our patients. And sometimes we use ball. People have to sit on the ball and they have to see to the light. And sometimes we give them sound therapy and sleep therapy, and it feel much more real, and they to avoid them from sleep and something like that. So the more light used, the more faster moving object is much more better. So this is our Balites, which is home based. What I'm saying, because home based, they can do at home with a very simple, because in this module, we have a CD, we have manual book, and we do have a poster. And the most interesting one, we do have 16 languages, which is we do have Tamil, Hokkien, Mandarin, Arabic, and I think we do have in Urdu, Sin. And this is very simple. They have an audio, they have, guidance, everything. And it's safe, because normally there is instructions there when they do have a chest pain, something like that, they should do ECG, something like that. All right. So, and Alhamdulillah, actually last year I was in Bosnia and Turkey. And Balak is actually used in Bosnia and Turkey as their balance assessment and rehabilitation protocol in their country. And I really hope in future, other countries also can benefit from this model because this is home based. And the video that I cannot show here, but we supply in in online version, something like that. But you should contact me in behind. All right. So for example, like here, actually we do have our grant is almost 100,000 Malaysia. We compact the Balat's model, which is with prayer movement and without prayer movement, which is a customized potency, and it shows in terms of it's seen a good psychological changes happen in patients that using model with prayer movement compared to the non-prayer movement. All right. So this is for example of our foam. Then Balak Creek Balance, which is they have a protocol. This is the example of the protocol. There's a step. This is only a few steps. They have almost like more than 30 movement, what they can do or what they should do while they are standing on this form. All right. So if you ask me, I will say I really practice. I really love and recommend the Balai Creek Balance because you can get a very faster recovery. People normally stay in my clinic with me. For example, if they came all over from overseas, they need to stay at least 3 to 4 days. And Alhamdulillah, when they back, normally they be back with 70% or 60%. It depends on their commitment to do the exercise. So there's a lot of benefits. Actually, it's not really expensive, and
Doctor.
we have a protocol provided. Non-physio can do if you are trained properly.
Doctor?
All right, so this is our standard. Yes, I'm almost done.
Yes, I just want to say that it may cut off because we're almost up of time. So in case it happened, I want to just make sure.
Okay,
Thank you, and I'll give you the continue. Thank you.
Yeah, thank you so much. Sure, it's very thing. So this is all the thing actually. This is all the picture actually, all the achievement. Alhamdulillah, I think I have done this innovation 15 or 17 product, and I awarded more than 44 gold medal international and international. That doesn't matter, but the most important thing is actually for me, we can share, and the last word for me is actually when you have a vestibular patient, balance exercise is the most important thing. I'm not saying or I'm not ban the medication everything, no, but you should emphasize in your patient. For example, like medication like anti-suppression is not really good if they use more than 2 weeks or something like that. So that's why what we call the proper advice and